Hey everybody, welcome to Supplementary Video 7.2. So we're going to be talking about section 7.2 from the textbook. It's all about the skull and structures of the skull, but the skull has lots and lots of bones, lots and lots of things going on with it. So this section is actually going to be broken up into a part A, B, and C. So we're going to break it up into a little more manageable chunks, hopefully, and see if we can't tackle a skull one slide at a time here. So we're going to start with an anterior view of the skull. Okay, so you have the orbit, which we already talked about the orbital region back in Unit 1. The orbit is going to be the socket, which is going to house the eyeball and all associated muscles. You have different parts here, so we're going to start with the superior crest. Remember, superior meaning up basically towards the head. You have this crest here, which is going to be called the supraorbital margin. And at about the midpoint, there's going to be a supraorbital foramen, which I'm just now realizing this skull is missing, but I promise you that it's there. But that's going to be where a sensory nerve that reaches to the skin of the forehead is going to exit through that supraorbital foramen. Inferior, so below the orbit, you have the infraorbital foramen. You're going to have a different sensory nerve there that's going to be supplying the anterior face, and that's going to emerge. And this one, the skull actually does have. You can see there underneath each eye orbit, there is an infraorbital foramen. Okay. And then another thing you'll notice from the anterior skull is this nasal cavity, very, very prominent here. And hopefully you're able to see within there. It is split in half by the nasal septum. So the superior portion of the nasal septum is going to be formed by the ethmoid bone, which we're going to get into when we look within the cranial cavity here. But the anterior portion, the front portion, is going to be formed by the vomer bone. The inferior and middle nasal conchae can also be seen from this view here. I'm not sure, hopefully you're able to see those kind of ridges there on the inside of the nasal cavity. So on the inside here, you can see the inferior and the middle nasal conchae. There is also a superior nasal conchae, but from an anterior view of the skull, it is actually hidden. The middle and superior nasal conchae are going to be another part of the ethmoid bone. So here you can see, unfortunately, I don't have a disarticulated skull. They cost a few $100s to be able to get one, to be able to and take it apart bone by bone like this. So a picture we'll have to do. But you can see here the frontal bone. There's where the supraorbital foramen sits. Unfortunately, for some reason, the skull does not have one, but about at the midpoint of the supraorbital margin. And then down here, you have your infraorbital foramen that we're able to see, the nasal cavity with the inferior and middle nasal conchae. And again, that superior nasal conchae is hidden from this view. So looking at the brain case, the floor of the brain case, or basically the middle or the inside of your brain case on the floor, has lots and lots of openings for things like cranial nerves, blood vessels. The spinal cord is going to pass through here. So lots and lots of things going on the floor of the brain case. The base can be divided into 3 sections, and as you move posteriorly, so remember, here's our face here, just to keep us oriented here. As you move posteriorly, those 3 sections are going to get deeper. You're going to have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. And so you can kind of see these here in the video, where we have the anterior cranial fossa, the middle cranial fossa, and then our posterior cranial fossa. And here's another picture for you to be able to see, just in case that doesn't show up on the video quite as well, but you can see where the brain's going to sit here within that anterior, middle, and posterior cranial fossae. Continuing on with the brain case, there are 8 bones that compose the entire brain case. You have the parietal bones, and you do have 2 of them. You have a right and left parietal bone. So here, this would be our skull cap. This would be the anterior portion. If we just look down with the skull here, you can see our right and our left parietal bones. They're going to form the superolateral portion of the brain case, and there are two of them, a right and a left. You also have two temporal bones, which are going to form most of the inferolateral portion of the brain case. So I'll put our skull back together here and point those out. And the temporal bone is also going to include several things like the styloid process, the mastoid process, external auditory meatus, mandibular fossa, and other landmarks here. So I'll point those out here. So you have the temporal bone here. It's kind of hard to see the sutures and the dividing line, but this approximately here is going to be the temporal bone. Think your temple. It's actually named because this is approximately the first place that turns gray when you get old, and so temporal meaning time. So this means relates to time here. But you have things like the styloid process under here. This is shaped kind of like a stylus, very thin, very pointed here. So that is your styloid process, and it is right next to the mastoid process, another bony projection. Right here, the mastoid process is a lot bigger, a little more blunt. Then you have the external auditory meatus here. This is going to be your ear canal. You also have mandibular fossa, which is going to be an oval-shaped depression, part of your TMJ here. So again, here's our temporal bone. So you can see how that temporal fossa here is going to be, or the mandibular fossa here is going to be a part of our temporal mandibular joint. Okay. Moving on, you also have the frontal bone. This does get covered in the normal high school portion of the lecture here, but the frontal bone forms the anterior brain case between the frontal bone, between the eyebrows, I should say. You do have a slight depression, which is known as the glabella. I'll put this here. He doesn't like to stay together very well. But you can see just this little depression in between the eyebrows here going to be our glabella. You also have the occipital bone forming the posterior skull. Again, this is also covered in the normal high school lecture here. But the occipital bone on the backside here, it does also, the occipital bone does include the base of the skull here. So you have your occipital bone, which you might be able to see. I'll move the sticker here. Might be able to see the divider, the suture here. So everything below that or inferior to that is going to be part of the occipital bone. And it includes things like the external occipital protuberance, this little bump here, more pronounced in males, as well as the foramen magnum or big hole in the bone. That's going to be where the spinal cord exits. You do also have occipital condyles here on the base here, if I can find them from this direction here. That's going to be where your vertebrae, your first vertebrae, the atlas, is going to articulate, is on those occipital condyles. Going back here to the posterior side, you do have superior knuckle lines, which are lateral to the external occipital protuberance. Those are going to be the marking to where the highest point of attachment for neck muscles are. So be superior to that, to those knuckle lines or nuchal lines. You don't have any muscle attachment from the neck. You start getting into some other structures there. Okay, so hopefully this shows up a little bit better than some of those did on the skull here. Here we'll take a look at the posterior view first. You can see the occipital bone. Here we go. Well, you can see the occipital bone, the paired parietal bones, temporal bones, also on those lateral sides there. The superior nuchal lines marking the most superior point of attachment for neck muscles. You also see some other structures that we covered here, the foramen magnum, occipital condyles. Trying to think what else. And you can see the three fossa, the anterior, middle, and posterior cranial fossae. Okay, so now looking within our skull, we have the sphenoid bone, which is going to be the most important one. It is the keystone of the skull because nearly every other bone within the skull is going to be connected somehow to the sphenoid bone. So it forms most of the base of the central skull. It does form a little bit of the lateral skull. And we'll see why here in a second. The right and left lesser wings are inside the cranial cavity. They're going to form a ridge that separates the anterior and middle cranial fossae. So these are going to be part here. They're not very well defined on my model here. You also have the sella turcica, which translates as the Turkish saddle. Sits at the midline of the cranial fossa. So this is your sella turcica right here. Within that space there, you have the pituitary fossa, and that's where the pituitary gland is going to sit. A very, very important gland of your endocrine system. You also have the greater wings, which are going to be extending laterally from the sella turcica, from the anterior floor. They're going to form a small rectangular area on the lateral skull. And again, that's not very well defined here, but you would actually be able to see the lateral ends of those greater wings of the sphenoid bone on the lateral skull, because they do reach the outside. You also have the medial pterygoid plates, which are going to form part of the posterolateral walls of the nasal cavity. So those are going to be all the way up here. And I'm just now realizing this was a very poor choice to see a model to see the sphenoid bone. You do also have lateral pterygoid plates, which are going to provide attachment sites for muscles on the anterior side, or on the anterior and lateral side. Okay. So this is going to show up a lot better here. You can see that sphenoid bone here in the middle, very, very important. You got that Turkish saddle right here, where that pituitary gland is going to sit. We'll see a different view later. Maybe this view back here. Yeah, never mind. We'll get to the greater wings later. Okay. But you can see the greater wings extending laterally here, very, very prominent. The pterygoid plates coming down here, lesser supplying chewing attachment for muscles. We covered that. I'm trying to think if there's anything else I can see here. But you can see from this image here how the occipital bone, the temporal bone, parietal bones, frontal bones, even coming up here to the vomer, because here you can see the medial and lateral pterygoid plates are going to all articulate with that sphenoid bone. Okay, other bones within the brain case, you have the ethmoid bone. It's going to form the roof and the lateral walls of the nasal cavity. It's also going to form the superior portion of the nasal septum. We covered that earlier, and it will contribute to the medial wall of the orbit and a portion of the anterior cranial cavity floor. A big structure, or an important structure in the ethmoid bone, is the Crista Galli, which translates rooster's comb or rooster's crest. It's a small superiorly pointed projection, which serves as an attachment point to one of the meninges, which is one of the protective layers of the brain. It also has two cribriform plates, which are lateral of the Crista Galli. They're very small and flat areas where you have lots and lots of olfactory foramina. Remember those holes, those foramen, plural is foramina, to allow those to pass through there. Lateral portions of the ethmoid bone have air-filled spaces, which are going to be part of your paranasal sinus system, your sinuses. So you can see here those ethmoid air cells, part of your sinus system. There's the Crista Galli, and lateral to that, the cribriform plates. Here is the perpendicular plate that's going to contribute to the superior portion of the nasal septum. Okay. Another thing with the skull is the sutures. So sutures are an immobile joint of the skull. It's very weird to think that your skull actually has joints outside of the mandible, but you do have bones coming together. And so you have these sutures, and I'll just use our skull cap here. So these sutures here are very jagged lines filled with dense and very fibrous connective tissue. You have the coronal suture, which is going to join the frontal bone to the right and left parietal bone. So this is the coronal bone. Think it runs along-ish the coronal plane. It's sort of a little V-shaped So it's not exactly coronal plane, but it is very close. You have the sagittal suture. This one's a very pronounced one, joining the right and left parietal bones. And on the posterior side, you have the lambdoid suture, joining the occipital bone to the right and left parietal bones, and it actually does extend all the way over here to join the occipital bone to the temporal bones. Here on the lateral portion of the head, you have the squamous suture, which is going to join the parietal bone to the temporal bone. And so it kind of gets cut off by where they have the skull cap cut here, but that's where the squamous suture would be. And so as a result, and it doesn't show up here, you have what's known as the terion. The terion is a roughly H-shaped line of sutures formed from where the frontal bone, parietal bone, temporal bone, and the greater wing of the sphenoid bone are all in one area. And so you have these suture lines running through there, forming this H shape. And as a result, this becomes the weakest part of the skull. So you may have heard of somebody saying, right here in your temple, this is where you need to hit somebody to knock them out. It's because of all those sutures that are running through there that makes it the weakest portion of the skull. Okay, so again, this is the first part of chapter 7.2. So this is part A video. We'll dive later into the chapter in another video, but hopefully you're able to follow along with what we have going so far in that chapter. And as always, let me know